The term phobia is familiar even to common people. We all have heard about people having phobia of something or fear of something. The term phobia is always associated with the terms fear, and it is obvious that there is indeed a connection between phobia and fear. What is the connection between phobia and fear, and how does these two terms differ from each other? As part of normal life, many of us may feel uncomfortable or fearful at times about certain objects or situations. It is normal to feel fear because fear is actually a normal emotional response to something that we fear. However, if such experiences become feared and disrupt life to the point that we are unable to enter social situations or to carry out our work and everyday activities, this may be due to an anxiety disorder called phobia.
In previous study, researchers had found that the way of the brain of affected individuals show difference in their responding to facial expression. They suggest that this condition involves increased their responsiveness to the social stimuli in area linked to the emotion. Patients with generalized social phobia show increase in blood flow in medial prefrontal cortex and amygdala. It is a big part that links to the self-concept as well as fear, emotion, and self-response.
Specific phobia involves a fear about a specific situation, living creature, place, activity, or thing.
Social phobia is a strong fear of being judged by others and of being embarrassed. Persons with social phobia fear of being criticized by others. Some of the symptoms are fear of situations in which you may be judged, and worrying about embarrassing or humiliating yourself. A person with social phobia often think negatively about what others might think about them. Their imagination are usually untrue. In the end, the person will leave the social situations without facing it. Agoraphobia can be termed as a fear of being in a crowded place or open space. It often develops after a person experiences one or more panic attacks. Some of the symptoms are hard breathing and rapid heartbeat. One of the examples of agoraphobia is claustrophobia, in which a person has fear for enclosed space. Cognitive behavioral therapy aims to help you to change the way that you think, feel, and behave. It is used as a treatment for various mental health and physical problems.
Hypnosis is an easy and quick method for releasing even deep-rooted fears. Hypnosis allows a person to access repressed memories during a hypnosis session. The hypnotherapist can then help them eliminate negative associations and replace them with positive ones. Hypnosis targets the fear, stress, and anxiety that the fear causes and reprograms the subconscious mind to get rid of the negative association.
Virtual reality exposure therapy places the client in a computer-generated world where they experience the various stimuli related to their phobia. After an intake session and skill-building sessions to teach the patient how to control automatic responses to anxiety-provoking situations, the therapist and client collaborate to create a hierarchy of anxiety-inducing situations. Each stage can be repeated until the client is comfortable with the experience and satisfied with their response.